Welcome to The Explainer. Today, we're building a practical study tool, breaking down one of the most vital frameworks in healthcare today, trauma-informed nursing. We're going to get into the core principles you absolutely need to know to give care that's not just effective, but also compassionate and fair, especially for patients who need it most. So here's our roadmap for today. We're going to start in a really high-stakes environment, a correctional facility, to see why this all matters so much. From there, we'll unpack what trauma actually is and look at the frameworks built to deal with it. Then, we'll apply all that knowledge to a specific example, caring for transgender patients, before we wrap up with a call to action for every single one of us in this field.
All right, so our first stop, it's a setting a lot of nurses might never work in, but it's a place where this work is just so incredibly critical, inside correctional facilities. Understanding this environment, well, it's key to grasping the real need for a trauma-informed approach.
So you have correctional nurses, right? They're the ones on the front lines in prisons, jails, detention centers. They're caring for a population that we're now encouraged to call justice-involved. And listen, this isn't just about being politically correct. That simple shift in language, it's literally the first step towards seeing the person, not the prisoner, and starting to build trust.
And this is where it gets really stark. The people in these facilities, they are not a random slice of the population. Just look at these numbers. You see this massive overrepresentation of groups who already face systemic barriers. This is not some coincidence. It's a direct outcome of systemic racism and social determinants of health, which, by the way, are forms of trauma we're going to talk about in a minute.
So what does the day-to-day actually look like? Well, from that very first moment someone comes in, that intake screening, to managing chronic conditions like diabetes or dealing with sick calls, the correctional nurse is often the one and only healthcare provider these patients can access. It's a huge responsibility, and it takes an incredible amount of skill. Okay, so seeing the reality of a place like a prison really forces us to ask the big why, right? To give good care there or really anywhere, you have to understand that trauma isn't simple. It's profound, and it is layered. And this model right here, the socio-ecological model, is an absolute game changer for getting it. It shows us that trauma isn't just one bad thing that happened. Nope, it's a series of circles, one inside the other, from the deeply personal all the way out to the structure of society itself. And they all feed into each other. As nurses, we have to be able to see all of it. Right at the very core, you've got individual trauma. This is the stuff that happens directly to a person. We're talking abuse, neglect, a serious illness, things that directly impact their body and their mind. Then, one layer out, you have interpersonal trauma. This is the harm that happens between people, within relationships. Think domestic violence, bullying, sexual assault, harm inflicted by partners, by family, by peers. Zooming out even further, we get to collective trauma. This is the kind that hits entire communities, entire groups of people. Think about the lasting scars of war, or widespread violence in a neighborhood, or the historical trauma that indigenous communities carry from things like colonization. And finally, we get to the outermost layer, structural trauma. Now this is the harm that's baked right into the systems that run our society. It's racism, it's poverty, it's transphobia, it's policies that actively create barriers to being healthy and safe. Okay, so we've seen the problem, and man, it is complex. Trauma has layers. So what's the solution? How do we even begin to build a way of giving care that actually meets this reality? Let's get into it. The starting point is something called trauma-informed care, or TIC. It's all based on these 6 principles you see here. And this is a huge shift in thinking. Instead of asking a patient, "What's wrong with you?" we start asking, "What happened to you?" The whole goal is to create a safe space and to make sure we don't accidentally cause more harm. But here's where the thinking has really leveled up. We're now talking about TVIC, trauma and violence-informed care. Adding that V for violence, that is the crucial step. It forces us to see that for so many people, trauma isn't just something from the past. It's an ongoing experience caused by the violence of racism, poverty, homelessness, things that are happening right now. So let's put this TVIC framework to the test. How does it actually work in the real world? We're going to apply it to an area of care where it is desperately needed, creating a safe and affirming healthcare experience for transgender and gender-diverse patients. And if you want to know why this is so urgent, just look at this number. A national survey found that 70% of transgender and gender-diverse people said they face discrimination while trying to get healthcare. 70%. Just Let that sink in for a second.
And that discrimination, it shows up in some really ugly ways. We're talking about providers using abusive language, refusing to even touch a patient, blaming them for their health issues, or just straight up denying them care. These aren't just bad experiences, they are dangerous barriers to people getting the help they need.
So, where do we even begin to fix this? Well, it has to start with us on an individual level. It's a personal promise to educate ourselves, to learn the language, to always respect pronouns, and to do that really hard internal work of looking at our own biases so we don't bring them into the exam room. And then we have to take that individual commitment and make it real in our workplaces. This means being the person who pushes for things like gender-neutral intake forms, normalizing pronouns on name tags, making sure policies from room assignments to health screenings are based on a person's actual identity and needs, not just some box they checked. And finally, we have to tackle this at the education level. We've got to bake these principles into the foundation of nursing itself. Cultural humility and trauma-informed care, they can't be electives anymore. They have to be mandatory, core skills for every single person who wants to be a nurse, period. So when you put all of this together, what's the big takeaway? It's that our role as nurses is so much bigger than we might think. We're not just here to treat sickness after it happens. We have to be part of creating a culture of safety and actively preventing the violence that causes so much of this trauma to begin with. And the great news is, we have a tool for that. This public health model gives us a clear 4-step process. Step 1, define the problem. Step 2, figure out the risk factors. Step 3, develop a way to prevent it. And Step 4, make sure people actually use it. This is our blueprint for moving from just reacting to being truly preventative. And all of this leads us to the final and maybe the most important question for our study tool today, the one we really want you to take with you. Beyond the charts, beyond the procedures, how can we make sure that healthcare feels safe, respectful, and affirming for every single person who walks through our doors? Because getting the answer to that question right, that is the ultimate goal.